Hi, and welcome to another installment of the Aruka SDA Church Health Ministries Health Nugget series. For this quarter, we are discussing hypertension. I am Nikisha Scantbury Fortune, and for today's presentation, I will be discussing clinical presentations and manifestations of hypertension. One of the most dangerous things about hypertension or high blood pressure is that you may not know you have it. In fact, nearly 1/3 of people who have high blood pressure don't know it. That's because high blood pressure doesn't have any symptoms unless it's very severe. The best way to know if your blood pressure is high is through regular checkups. You can also monitor blood pressure at home. This is especially important if you have a close relative who has high blood pressure. And we learned in the previous episode that high blood pressure runs in families. What are the blood pressure categories? And according to the American Heart Association, the blood pressure categories for normal blood pressure is where the systolic, which is the upper figure, is less than 120, and the diastolic, which is the lower figure, is less than 80. Elevated is considered when the systolic is 120 to 129, and diastolic is less than 80. High blood pressure, stage 1, is where the systolic is 130 to 139, or diastolic is 80 to 89. High blood pressure, stage 2, is considered when the systolic is 140 or higher, or diastolic reading is 90 or higher. And in a hypertensive crisis, this is where the systolic is higher than 180 and or the diastolic is higher than 120. Most people with high blood pressure have no signs and symptoms, even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds, but these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. So we saw where if a person is in a hypertensive crisis, the blood pressure reading will be 180 over 120 and greater. Signs and symptoms of hypertension. When symptoms do occur, they can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, buzzing in ears, and symptoms for severe hypertension. These could include fatigue, nausea, vomiting, confusion, anxiety, chest pains, and muscle tremors. But the only way to find out if you truly are hypertensive is by measuring your blood pressure. Hypertension can also occur in pregnancy, and this is called gestational hypertension. Gestational hypertension is a high blood pressure reading that occurs in pregnancy. It occurs in about 6% of all pregnancies. This condition is different from chronic hypertension. Chronic hypertension happens when a woman has high blood pressure before she gets pregnant. It's also different from preeclampsia and eclampsia. These are other blood pressure problems that occur in pregnancy. After 20 weeks of pregnancy, blood pressure that exceeds 140 over 90, documented on 2 or more occasions, at least 4 hours apart, without any other organ damage, and with no excess protein in the urine, is considered to be gestational hypertension. Gestational hypertension often starts in the second half of pregnancy and normally goes away after the baby is born. What are the signs and symptoms of gestational hypertension? Symptoms can occur a bit differently in each pregnancy. The main symptom is high blood pressure in the second half of pregnancy. But some women don't have any symptoms. High blood pressure in pregnancy can lead to other serious issues. These can include preeclampsia. So some symptoms for gestational hypertension may include increased blood pressure, absence or presence of protein in the urine, edema. You may have swelling to your feet, sudden weight gain, visual changes such as blurred vision or double vision, nausea and vomiting, right-sided upper abdominal pain or pain around the stomach, urinating small amounts, and changes in liver or kidney function tests. When to see a doctor? If you have any of these symptoms, see a doctor immediately. You could be having a hypertensive crisis that could lead to a heart attack or stroke. You may also have other serious health conditions. Most of the time, high blood pressure doesn't cause headaches or nosebleeds, but this can happen in a hypertensive crisis when blood pressure is above 120. It's important to remember that high blood pressure doesn't usually have symptoms, so everyone should have their blood pressure checked on a regular basis. You can have high blood pressure for years without any symptoms. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack, stroke, eye problems, and kidney failure. Fortunately, high blood pressure can be easily detected, and once you know you have high blood pressure, you can work with your doctor to control it. Know your numbers. Fight the silent killer. Check your blood pressure. Your body is the best thing you could ever invest in. Take care of it, and it will reward you with a lifetime of health and happiness. You are worth it. According to Ellen G. White in Counsels on Health, page 168, through the agencies of nature, God is working day by day, hour by hour, moment by moment to keep us alive, to build up and restore us. When any part of the body sustains injury, a healing process is at once begun. Nature's agencies are set at work to restore soundness, but the power working through these agencies is the power of God. All life-giving power is from Him. When one recovers from disease, it is God who restores him. Thank you for watching, and I pray that you, the viewers, continue to be edified and blessed by the health nuggets presented by the Aruka SDA Health Team.